Happy Monday, Bio 47. Today I'm going to be talking through Lab 12, the skeletal muscle of the lower extremity. So everything of the lower limb, colloquially known as the leg. Before I wanted to give you some tips about these next few labs. So labs 13, 12, and 14, today, Wednesday, and next Monday, are all identifying skeletal muscles. So for these three labs, what you should be able to do is to identify and to locate all of the bolded and underlined muscles that are listed in the lab manual. So know their names, what they look like, and where they're found. In addition, for each muscle, you should know its origin, its insertion, and its primary action, which is listed in italics in the lab manual. So you're only responsible for the primary action. That's the one that's listed in italics. Sometimes you'll see some additional information as well. In order to know these, some things that you might want to do would be to make flashcards. So write out the name of the muscle, and then on the back have its origin, its insertion, and its action, and anything else that would help you remember that muscle. This seems like a lot of information to memorize, and it would be, but they aren't all disparate facts. You know from your muscles homework that if you know the position of a muscle, then you probably are able to guess at its action. So if you know if it's on the anterior side or posterior side, the joint that it crosses, you'd be able to guess at its action. Similarly, if you know the action of a muscle, you can probably take a good guess about its location and where its origin and insertion are. So it's a lot of things to know, but it's not all just separate pieces of information. These are things that you can reason your way through as you get some familiarity with the muscles. The last thing that I would do would be to study diagrams and three-dimensional models to really get an idea for how these muscles fit together, where they are in the body. And for this, I would use Visible Body, that program that we now have a free subscription to, that you should be able to log in and create your own access to, and access to this course. So I'm going to talk through first muscles that are responsible for moving the thigh. So these are muscles that are responsible for moving the thigh. They adjust the position of the hip joint, and these originate from the pelvis or the vertebral column and insert onto the femur. So first I'll look at muscles of the gluteal region. And as I'm going through these muscles, I'm trying to follow the order that these muscles are listed in your lab manual. So you should be able to follow along in the lab manual. Sometimes I'll have to jump around a little bit depending on the images that I'm using. I'll try to let you know when I'm doing that. So of the thigh movers, the first one that we're looking at is the gluteal region. And these are on the posterior side. The first one is the Gluteus Maximus, the biggest gluteal muscle. It's defining the shape of the buttocks. It's superficial. It has its origin on the ilium, on the sacrum, and on the coccyx. And its insertion is on the iliotibial tract, or the IT band, as well as the gluteal tuberosity of the femur. Its action is in hip extension and hip lateral rotation. So if you think about doing a move like rollerblading, the propulsive movement of rollerblading, that would be hip extension and hip lateral rotation, powered by Gluteus Maximus. Also in the gluteal region, you'll find Gluteus Medius, and a lot of Gluteus Medius is obscured by that superficial Gluteus Maximus. So Gluteus Medius originates more superficially, or more superiorly, along the iliac crest, and its insertion is down at the greater trochanter of the femur. And its action is in hip abduction and hip medial rotation. If you were to cut away Gluteus Maximus and Gluteus Medius, you'd be able to see the muscles that you can see over here on the right side. You'd be able to see Gluteus Minimus, which also has its origin along the ilium and its insertion at the greater trochanter of the femur. And like the gluteus medius, it's responsible for hip abduction and hip medial rotation. So gluteus medius and minimus have pretty much the same origin, insertion, and action, and they're responsible for tilting the pelvis while walking. Then, and I'm jumping ahead a little bit, just inferior to that is piriformis. Piriformis is the small pear-shaped muscle that's inferior to gluteus medius, gluteus minimus. It's deep to gluteus maximus. It originates on the sacrum and inserts on the femur, and it's responsible for hip lateral rotation and for abduction. The last that's in this area, but it's on the lateral side, so now we're getting a lateral view, is the tensor fasciae latae. The tensor fasciae latae is a muscle that's responsible for tensing the lateral fascia. So it's responsible for tensing the iliotibial tract, or sometimes called the IT band. So this muscle up here is the TFL, or tensor fasciae latae. It originates at the iliac crest and at the anterior superior iliac spine, and it inserts at the iliotibial tract. On the cadavers, it's enclosed in the IT band. It's responsible for tensing this whole iliotibial tract and stabilizing the hip and the knee. So that's the tensor fasciae latae, the only muscle in this lateral compartment of the thigh. Next, we're looking at the Iliopsoas group. That's the primary hip flexors. The first one, the iliacus, has its origin in the iliac fossa, so it's anterior, and its insertion down at the inferior border of the lesser trochanter. And then the psoas major has its origin along the lumbar vertebrae and its insertion at that inferior border of the lesser trochanter, but it's traveling more medially to get there. So this one's psoas major, more medial, iliacus, slightly more lateral down to their insertion at the lesser trochanter. Both of these are responsible for flexing the hip. Additionally, psoas major, because it crosses these lumbar vertebrae joints, it's responsible for flexing the spine. So sometimes when you think you're doing ab exercises, you think that you're doing a crunch, for instance, and working those abdominal muscles. The first third or so of the crunch, you're working the abdominal muscles. But beyond that, what you're actually doing is flexing the hip. And when you're flexing the hip, you're using psoas major. This is one reason why when you think you've done a really hard ab workout, sometimes your lower back, your lumbar region hurts. And that's because you've overworked psoas major, with just pulling on those lumbar vertebrae. So it's playing that role in hip flexion and in spine flexion. To be able to see these muscles, we'd have to look inside of the abdominal body cavity. You have to move all of the digestive organs, all of the intestines that overlie these muscles, to be able to see these two muscles along the posterior body wall. So they're both responsible for hip flexion. Now I'm moving down into the muscles of the thigh, and we're looking at the anterior surface. And the big group on the anterior surface of the thigh is the quadriceps group, Quadriceps femoris. Quad means four, so we're looking at a muscle group with four different heads. And the first one of this quadriceps group is illustrated in yellow here. That's rectus femoris. Rectus femoris has its origin up at the anterior inferior iliac spine and its insertion down at the tibial tuberosity. The whole quadriceps group has this really interesting insertion. What they do is converge onto the quadriceps tendon. The quadriceps tendon attaches all four muscles to the patella, which is a bone. So muscle to bone is a tendon, the quadriceps tendon. Then from the patella to the tibial tuberosity, that's bone to bone, we have the patellar ligament. So the insertion for all four quadriceps muscles is the quadriceps tendon to the patella, to the patellar ligament, to the tibial tuberosity. And because of this insertion at the tibial tuberosity, all four of these muscles will be extending the knee or extending the leg at the knee, basically kicking a ball. The next muscle of the quadriceps group is Vastus Lateralis, shown in blue here. Vastus Lateralis has its origin on the femur and its insertion down in the tibial tuberosity. So it's responsible for extending the knee. Vastus Medialis is on the medial side, and it has its origin on the posterior medial surface of the femur along the linea aspera, and its insertion down at the tibial tuberosity by way of quadriceps tendon, patella, patellar ligament attaching to tibial tuberosity, and it also extends the knee. To get a look at Vastus intermedius, the fourth quadriceps muscle, what we'd have to do is pull Rectus Femoris out of the way. So I'm going to show an image of that for just a second. So this is a person turning fairly quickly with the four quadriceps muscles illustrated. So we get posterior view right now, and now anterior view and posterior view. So right in here in red, that's the most medial muscle. That's going to be Vastus medialis. And on the sides in yellow, that's the most lateral of the quadriceps group. That's Vastus lateralis. And then in blue is the only muscle of the quadriceps group that crosses the hip in addition to the knee. That's Rectus Femoris. And Rectus Femoris, therefore, can not just extend the knee, but can also flex the hip. And illustrated deep to Rectus Femoris in orange, you'll be able to get you a little glimpse of Vastus intermedius, the most intermediate of the vastus. It has its origin on the anterior femur, and most of its muscle belly is up near the femoral head, and then it converges on that common quadriceps tendon down to the patella, to the patellar ligament, to the tibial tuberosity. So it's also responsible for extending the knee. So all four quadriceps muscles extend the knee, and just Rectus Femoris can participate in hip flexion because of that insertion on the ilium. So I'll go back. So Rectus Femoris, this one in the middle, it has a distinct bipennate fascicle arrangement. So there's that center line, and then fascicles that look sort of like a feather around the shaft of a feather. It's the most anterior on the lateral side, Vastus lateralis, medial side, Vastus medialis, and deep in the leg would be Vastus intermedius. The last one on this anterior compartment is the Sartorius muscle. The Sartorius originates up at the anterior superior iliac spine, and then it crosses the thigh and extends down to the medial surface of the tibia. And so it crosses the hip joint and can cause movement at the hip. It crosses the knee joint and can cause movement at the knee, and crosses diagonally across the thigh. And that arrangement contributes to its three actions. That is lateral rotation of the thigh, flexion of the hip, and flexion of the knee. If you were to sit with crossed legs, then you're doing all three movements of the Sartorius muscle. Supposedly, this is how tailors sit when they sew clothes. So this is the tailor's muscle. Sartorius in Latin is this root word for fashion or for tailoring. So it's the tailor's muscle that allows you to sit with crossed legs. The Sartorius, it's the longest muscle in the body. It crosses the thigh like this Miss America sash. Over here in this version, you can see Sartorius, the tailor's muscle, crossing diagonally across the thigh. You can see Rectus Femoris with that bipennate fascicle arrangement, Vastus Lateralis, Vastus Medialis. Up here would be Tensor, Fasciae, Latae. You can see iliacus and psoas major, making up that iliopsoas group, the hip flexors. And then we'll get into this adductor group, these muscles that are responsible for bringing the thigh back toward the midline. So these muscles are all going to be on the medial surface of the thigh. There are 5 different muscles that make the adductor group. The first one is the gracilis. This is the most medial. It's a strap-like muscle of the thigh. It originates at the pubis and inserts down at the anterior medial surface of the tibial condyle. Its primary action is adduction of the thigh. Because it crosses the knee, it can also participate in flexion and medial rotation of the knee. So a long strap-like, most medial muscle, that's the gracilis. Adductor magnus, you know it's going to be a really big muscle, Magnus. But from the anterior view, we just get a peek of it. So it has its origin up at the pubis and the ischium, and its insertion along the linea aspera, remember that rough line on the posterior aspect of the femur, is responsible for adducting the thigh. We move superiorly, then you see adductor longus. Adductor longus has its origin at the pubis and its insertion along the linea aspera, and it's responsible for adducting and flexing the thigh. Then superior to that is Pectineus. Pectineus originates at the pubis and has its insertion just inferior to the lesser trochanter of the femur. It also adducts and flexes the thigh. This is the superficial view over here on the patient's right. If you look over here on the patient's left, Pectineus and adductor longus have been cut away, and that reveals the last of this group of 5. That's adductor brevis. Adductor brevis originates at the pubis and inserts along the linea aspera of the femur. It's superior to adductor longus. Look where brevis ends and where longus ends. So longus is longer, brevis shorter and deeper to the pectineus and to adductor longus. And adductor brevis is also responsible for adducting and flexing the thigh. Now I'm moving to the posterior surface of the thigh, and these are the muscles that are called the hamstring muscles. These are 3 muscles that are collectively functioning to flex the knee. This is biceps femoris, semimembranosus, and semitendinosus, and all of them originate up at the ischial tuberosity. So on the lateral side is biceps femoris. Biceps femoris on the lateral side. Biceps means 2 heads. So it has its long head that originates at the ischial tuberosity and a short head that originates on the posterior femur. And you can't see where it's attaching in this illustration. Both the long and the short head have their insertion on the lateral surface of the tibial condyle and on the fibula. They're going to be responsible for flexing the knee. Both of the heads participate in knee flexion. The long head, because it crosses the hip and has its origin on the ischium, can participate in hip extension as well. On the medial side, there are 2 muscles, semitendinosus and semimembranosus. They form this structure that looks sort of like a hot dog in a bun. So semitendinosus is the hot dog, and semimembranosus is the bun that surrounds the hot dog. The semitendinosus is called tendinosus because it has a really long insertion tendon. It has its origin up at the ischial tuberosity, like all of this hamstring group. And then it's traveling along the posterior leg, really long insertion tendon. And its insertion is on that anterior medial surface of the tibial condyle. It's responsible for flexing the knee And because it crosses the hip, it can also extend the hip. Deep to semitendinosus, but wider and flatter, forming the bun for the hot dog. That's semimembranosus. It's more medial, so if you see something in the medial compartment, that's semimembranosus, M, medial membranosus, but it's wider and flatter, so it's on either side of semitendinosus. It has its origin up at the ischial tuberosity and its insertion down at the posterior medial surface of the tibial condyle. It's also responsible for flexing the knee and extending the hip. And one thing that's going to be beneficial to you is starting to think about how all these fit together. We've been talking about the anterior compartment, the posterior compartment, the adductors in the medial compartment, but they're all packed in there next to each other. So working with the three-dimensional models is going to help you figure out what you can see from which views. So here I'm looking at a posterior view, and you can see the big gluteus maximus. And then inferior to that, you can see the muscles of the posterior compartment that we were just talking about, the most lateral one, biceps femoris. And then you can see the hot dog in the bun. The hot dog is semitendinosus. And then the bun on either side of the hot dog, that's semimembranosus. But from this posterior view, you can also get a look at adductor magnus, that really big adductor that we can only get a little sliver of from the anterior view. You can see Gracilis, that long strap-like adductor from the posterior view. Often you can see Vastus Lateralis along the side, and that might be a little hint of Vastus Lateralis over there. And then up here, tensing the iliotibial tract, would be Tensor Fasciae Latae. And here's a view from the anterior and the lateral aspects, starting to put the pieces together. So here's the Tensor Fasciae Latae, viewed from the anterior view, and the iliotibial band, stabilizing the hip and the knee. Here's the Sartorius muscle, that Miss America sash, crossing over the thigh and crossing over to the medial side of the knee. And Sartorius and Tensor Fasciae Latae sort of form this V, this inverted V. And if you look inside the V, that's where you'll find the 4 quadriceps muscles. So 4 quadriceps muscles are visible right here. You can see the Vastus Medialis on the medial side, Rectus Femoris with that pennate fascicle arrangement, and Vastus Lateralis. You'd have to cut away Rectus Femoris to be able to see Vastus Intermedius. Then you can also see the adductor muscles from this anterior view. So here's Gracilis traveling down that long strap-like muscle, just a tiny piece of adductor magnus. This is adductor longus right here, obscuring adductor brevis. And then this piece right here is the pectineus muscle. Viewed from the side, the lateral side, you can see the Tensor Fasciae Latae and Gluteus Maximus with a common insertion on the IT band. You can see Rectus Femoris. You can see Vastus Lateralis on either side of the IT band. And then on the lateral side of that posterior compartment, you can see Biceps Femoris. So now we're getting down into the muscle of the leg. In anatomy, the leg is that part that contains the tibia and the fibula. The part above that, around the femur, is called the thigh. So now we're down into the leg, that more distal portion of the lower extremity. So if you feel your own leg and you feel for your shin bone, you're feeling that tibia in there. If you move lateral from the tibia and you feel a softer part that isn't bone, you're feeling Tibialis Anterior. It's just lateral to the tibia, has its origin along the lateral tibia, and then its insertion down at the base of metatarsal 1 and the cuneiform bone. The tendon of Tibialis Anterior passes over the surface of the foot to reach the first metatarsal. And when that muscle contracts, it's responsible for dorsiflexion, as well as for inversion of the foot, turning the sole of the foot inward. If you keep moving lateral from tibialis anterior, and I'm going to be a little bit out of order from your lab manual here. You move a little bit lateral, then you get to extensor digitorum longus. Extensor digitorum longus has its origin at the fibula and part of the tibia. And then it splits into 4 tendons that insert at phalanges 2 through 5. Its action is to extend phalanges 2 through 5. And then just sort of sandwiched in here between tibialis anterior and extensor digitorum longus is extensor hallucis longus. Its origin is on the anterior surface of the fibula, and it inserts down at the hallux, the big toe, and it's responsible for extending the hallux. There's 2 more on this anterior surface, but they're best viewed from the lateral side. And these are called Pectineus, longus, and brevis, or you can call them fibularis, longus, and brevis. Calling them fibularis, longus, and brevis will help you remember that they have their origin on the fibula. So longus has its origin more proximal, and brevis has its origin more distal on the fibula. And fibularis longus, or Pectineus longus, extends down, and its tendon wraps around the lateral malleolus, that bump on the outside of the ankle, and its tendon wraps under the foot to insert at the first metatarsal. And that means that it can not only participate in plantar flexion, but in eversion of the foot, turning the sole of the foot outward. Pectineus brevis, or fibularis brevis, has its origin along the fibula. Its tendon also wraps around that lateral malleolus and attaches at the base of the 5th metatarsal. So it's only responsible for plantar flexion. This is a cool pulley system for these 2 tendons to be able to get some additional strength by wrapping around the lateral malleolus. That adds some force to plantar flexion. So these are going to be important muscles for runners who are pushing off the ground a lot. For these muscles of the leg, it's difficult to identify them if you just see them in the leg. One thing to look for is to look at their tendons. So if you're just looking at a bunch of muscles, follow the tendon and see where the tendons go. Tibialis anterior, that muscle that's just lateral to the tibia, it has a tendon that runs out to the base of that first metatarsal over the surface of the foot. Extensor hallucis longus has a tendon that runs all the way out to the hallux, to the big toe. Extensor digitorum longus has a tendon that splits into 4 separate tendons, and those extend to phalanges 2 through 5. Over on the lateral side, there are 2 tendons that wrap around the lateral malleolus. Fibularis longus tends to be more superficial of the 2, and it also wraps under the foot to extend to the base of the first metatarsal and allow for eversion of the foot. The fibularis brevis, or Pectineus brevis, that also wraps around the lateral malleolus, tends to be deeper, and its insertion is just to the base of the 5th metatarsal. So you can tell by looking at the tendons what muscle you're looking at. Last but not least are the muscles of the posterior surface of the leg. These are the muscles that make up the calf. The first one is the Gastrocnemius. This is more superficial. It's 2-headed. It has its origin at the femur, the medial and the lateral condyles, and its insertion down on the calcaneus, that heel bone, by way of the calcaneal or the Achilles tendon. And this is what's forming the belly of the leg. So gastro means stomach, nemius means the calf. So it's the belly of the calf. It's that more superficial 2-headed big muscle. Deep to the gastrocnemius is the soleus, the sole of the foot, or sort of like a flat sandal. This is a muscle that has its origin on the posterior shaft of the fibula and the tibia, and its insertion down at the calcaneus. It has a common calcaneal tendon with the gastrocnemius, so they both converge on the same calcaneal tendon to do their action, which is plantar flexion, like when you're crushing a plant underneath your toes. They have some different purposes though. So gastrocnemius is primarily active in plantar flexion of jumping and running. So it's primarily white, fast twitch fibers. The soleus is doing plantar flexion in standing, in maintenance of posture, and it's primarily those red, slow twitch fibers. So I know that was a lot, but that's all of the muscles of the lower extremity. I wanted also to show you how to use visible body to practice with some of these muscles. So you'll be going to the Visible Body website, and you'll be logging into Bio 47, the course that I've made for you. And for the different labs, you'll be able to open up. So right now I'm opening up Lab 12, the lower limb muscles, what we were just talking about. And then I have some different assignments that are going to let you visualize some of the different muscles. So if I click on the lower limb, and it takes a while to load sometimes, and this is probably best viewed on a laptop or on a desktop computer, maybe a tablet, probably not a smartphone. So it's effective when it works. Sometimes it can take a while to load. You may have to close, refresh the page to get into it. And it's currently initializing. So now I'm looking at the muscles of the lower limb. I've got an anterior view of both legs, left over here, right over here. And some cool things that you can do are to move the view around. So you can look at the posterior view, you can zoom out, you can zoom in, you can zoom way out and way in. Other things that you can do, let's say you want to look at the anterior compartment and you're not totally sure what you're looking at, you can click on what's this over here. It'll tell you it's a tensor fasciae latae. If you look at what it's forming a V with, you should know that it's forming a V with the Sartorius muscle. You should be able to identify Rectus Femoris. On the more medial side, Vastus Medialis. On the lateral side, Vastus Lateralis. Other things that you can do are to fade muscles so that they become transparent, or you can hide them entirely. If you do, then you'll be able to see Vastus Intermedius, that fourth muscle of the quadriceps group that has most of its muscle belly up toward the head of the femur, and then this big tendon extending down to the quadriceps tendon, patella, patellar ligament, tibial tuberosity. So if you wanted to look at the adductor group, you could hide some of these big vessels. Let's see. And then you'd be able to see, let me hide some more of these. You'd be able to see this long strap-like one along the side here. You know that one's Gracilis. You could see a really big adductor right here. That's Adductor Magnus. Superior to that, you'd be able to find Adductor Longus, and superior to that, Pectineus. If you wanted to go looking for Adductor brevis, you could hide Adductor longus, and you'd be able to find Adductor brevis deep to that. So it's a cool feature to get to practice with some of these muscles, figure out what you can see from different perspectives, and really visualize where they are in relation to each other. So logging in, working with the muscles of the lower limb is your project for today.